Welcome to the Quiverful Adoptions podcast. We're your hosts. I'm Elizabeth.
And I'm Casey. We are two adoptive mamas who have walked in your shoes, so we get it.
We remember the crazy journey of adoption like it was yesterday, and we are so thankful we get to share some amazing stories with you right here from the living room of our office.
Well, actually, we're sitting in the bathroom, but the living room does sound better.
Anyway, none of that matters. We're glad you're here.
So grab a cup of coffee and join us as we dive right in.
Hey guys.
Hey friends. Happy Wednesday.
We are very excited about today's podcast.
Yeah, it's perfect timing, really.
So we're going to be doing an interview with Dr. Woods from Greenville ADHD Specialists. She is a Greenville ADHD Specialist is a center that's located in Greenville, South Carolina. And actually, she is my son Grant and Casey's son's daughter as well. So we're super excited to speak with her and just hear how ADHD is and why ADHD is something that adoptive families need to be tuned in to right now.
So one thing that she will be talking about is how ADHD can be more prominent in children that are adopted, how their medication affects them differently if they've been exposed prenatally to drugs or alcohol, and how we can parent these children differently from our children who don't struggle with ADHD.
Yeah, and just for some of you that might not yet be adoptive parents, or maybe you just adopted, this is something that I was aware of, but when we started the adoption process, as far as, there may be ADHD, increased ADHD, and my thought process, and I was a psych major, y'all, and I still, I just disregarded it, thinking, oh yeah, but who's not an ADHD kid in America today? Who does not have a hyper kid? And I just kind of brushed it off, but this is so much more than hyperactivity. This is something that Casey and I are both currently walking through with our children, and it has been very, very hard, and I don't think that there's enough adoptive families or adoptive voices out there that are talking about the actual struggles with our children that do have ADHD, and so we're really excited just to share with y'all today, and also to share as people who are walking through this currently right now. So we hope that you guys enjoy it.
Hey guys, thanks so much for listening in. We have Dr. Woods with us today from Greenville ADHD Specialist. Dr. Woods, can you tell us a little bit about yourself and why you're passionate about ADHD medicine?
Yes, I am a pediatrician for the past 36 years, and for 30 of those years, I practiced general pediatrics. I realized during that time that we did not really know enough about ADHD or give enough time to ADHD patients. And so I obtained some additional training, a mini fellowship in child and adolescent psychopharmacology through Columbia University in New York. And I felt like that training was very, very helpful. And at that time, then decided to focus my practice just on ADHD and the other issues that go along with ADHD in families.
Awesome.
You've been a godsend to Elizabeth and I and our family. So
absolutely.
Thank you for all that you're doing, for sure.
Oh, well, thank you.
Dr. Woods, can you give us just a brief description of ADHD?
Well, the term ADHD stands for Attention Deficit Hyperactivity Disorder, but it's really kind of a misnomer because not everyone who has ADHD has hyperactivity. In fact, many patients have either just inattention, or they have just hyperactivity, or they have hyperactivity and impulsivity. So there's a real variety of symptoms that present themselves and that are really ADHD. And the way we determine that is, of course, through testing. And the bottom line is that in the brain of folks who have symptoms of hyperactivity and or inattention and or impulsivity, there is a chemical called dopamine that's low. And dopamine in people helps them be able to be still when they need to be still, to pay attention when they need to pay attention, and to restrain their impulses when that's important. And folks who have ADHD have a lower dopamine.
So I know that whenever I was in the office with you the other day, I mentioned that several of my friends say that their kids are only on medications during the school year, but not on weekends or in the summertime. And I kind of joked and was like, yeah, their kids definitely don't have ADHD then. Can you explain to the community about how it is possible for their kids to not need it on weekends and in the summer, but my kid does?
Well, there is a difference in severity of ADHD. So some children really are very mild in their symptoms, and others are moderate, and some are severe. And the bottom line is that in those kids whose dopamine levels are really low, the medication that improves dopamine. That's how it works. And so in those kids whose levels are really low, taking them off medication is not recommended. And I don't recommend taking weekend breaks or school breaks off medication. It's those kids who have fairly moderate to severe presentations of their symptoms, because you're balancing brain chemistry by giving them the medicine that helps their dopamine. And when you don't do that every day, then those kids tend to have more difficulties.
So the kids that really only struggle with like attention, then they may not need it in the summer when attention isn't really important. Is that what you're saying?
That's
Okay.
yes, that's correct.
So what would you say are some of the causes of ADHD?
Well, the biggest reason that kids have ADHD is that it's genetic. So someone in the family, a parent, a grandparent, an aunt, or an uncle has ADHD, and it's passed down through the genes. Then if you have that predisposition to ADHD and you have adverse childhood experiences, either before you're born or after you're born, then that can make the ADHD present earlier and more severely.
So could this be like if a child that is adopted, if their biological mother does any type of drug use or alcohol use while she's pregnant, how can that affect a child having ADHD?
That would be a significant adverse childhood experience to the baby as it's growing in the womb, and those kids can be fairly severely affected with ADHD. And what I've learned in seeing some of those children is that they often require much higher doses of ADHD medications than kids who have ADHD but did not have exposure, in utero to drugs or alcohol or other noxious substances.
That makes sense.
It does. So you were saying because genetics play a factor, a lot of adoptive families don't have the full medical history of the biological family. And so even if the biological mother did not have any drug use or there weren't any adverse childhood experiences in utero, um, even still, because there could be genetics in the biological family that the adoptive family isn't aware of, there still could be a presence of symptoms that the adoptive family could look for and, relate that into, okay, maybe I need to go see about having an ADHD diagnosis.
Yes, that's correct. Often, and the other issue with that is that often the biologic family may have never had the diagnosis of ADHD, but that may have been what some of the issues were.
Right.
Frequently, we now know that people who were called bipolar disorder, people who have been in jail often for problems, those people are undiagnosed ADHD. And even if there's no diagnosis of ADHD, there could have been the presence of ADHD in biologic family members.
Makes a lot of sense because their impulsivity is just so strong. They've never been diagnosed, and so they end up doing things that are illegal and stuff.
Right.
Yes, that's correct. Yeah.
What are the most effective treatments for ADHD?
Well, there really are just three main treatments that have good scientific evidence that they work. One is medications. The second is behavioral modifications in the home. And when I say that, I mean emphasis on more positive parenting. And the third is behavioral modifications in the classroom. And usually that means accommodations for the child in the classroom, such as extended time for test, quiet place for testing, being placed in a seat in the classroom that's close to the teacher sometimes, or in the least distracting place of the classroom. It means giving extra help to students with note taking, with organizational skills. Those are all things that ADHD students do struggle with. And if the school setting can be helpful to them and be understanding and patient with them, then most ADHD students are very bright. It's just they have difficulty functioning in the classroom setting because of the ADHD. And if the ADHD is treated with medications, their functioning improves, but medication is not it doesn't fix everything.
Mm-hmm.
So it really takes a wraparound approach, is the way I like to think about it, of treating the ADHD with medicine, improving the parenting if possible, and allowing accommodations in the classroom setting. And all of those together can be very helpful.
I can remember coming into your office and just expressing, frustration about different things that Grant was exhibiting, and just, these symptoms that the ADHD children have, they can cause a lot of frustration. And so I remember you speaking a little bit and and just educating me on, how Grant cannot help some of these things. And some of the things that I can think of off the top of my head is his excessive singing. And he'll sing constantly, and you express like he doesn't more than likely he doesn't even understand that he's not aware that he's actually singing sometimes. Can you
Right.
just speak a little bit about, like, just to give someone, an adoptive family out there that isn't aware of symptoms, can you break down just a little bit more on how, like, they are not aware sometimes of these things that they're exhibiting?
Yes. So in some kids, the ADHD presents as extreme frustration and anger at what most of us would consider insignificant things.
Mm-hmm.
And so ADHD kids have a lot of difficulty self-regulating their emotional responses. So that's one thing. So if you have a child who blows up easily, frequently, multiple meltdowns, ADHD should be at least considered. And also kids who have ADHD have repetitive habits like humming or singing or making noises, biting nails, drumming fingers. There are a lot of repetitive behaviors that kids with ADHD have. And part of that is due to the fact that the ADHD brain lacking dopamine is constantly seeking stimulation. And so singing to themselves or humming, that's stimulating their brain, and that's what their brain seeks and wants. And so that's why they have the repetitive habits. And then the other thing is that often kids with ADHD have significant sleep issues. If people think about sleep as being separate from ADHD, it's not. It's a big part of ADHD often. Kids who have ADHD, their brains are not only low in dopamine, but they're also low in melatonin, which is it's just another chemical that our brain makes naturally, and it helps our bodies know when it's time to go to sleep. It helps our brain slow down and calm down. And kids who have ADHD that's untreated, they don't usually have quite enough melatonin, so they have a lot of difficulty quieting down, trying to go to sleep, staying asleep. They wake up early sometimes. It's sleep is a real difficulty.
So going back to the accommodations in school, I know that the public school setting has something called an IEP, which is an individualized education plan. My boys both have an IEP, and we are so grateful for it. But I think that a lot of parents probably don't even know that it exists. Are you able to tell the community a little bit about how an IEP can benefit a child with ADHD?
Yes. So there are actually two plans that the public school system has: the IEP, which is an individual educational plan, and a 504 plan. A 504 plan is primarily for kids who just have ADHD. They don't have any other learning issues or other significant emotional issues or other significant medical issues. But if kids have speech disturbances, or they have a reading disorder, a math disorder, a writing disorder, then they tend to have IEPs. And the way the school system determines what is to be included in an IEP or a 504 plan, what accommodations are needed, is that the parent has to start the process by contacting usually the counselor at the school. And most schools have a counselor who's designated as the person in charge of 504 plans or IEPs. You start that by scheduling a meeting. And at that meeting, you will meet with the counselor, usually an assistant principal or the principal, and the teachers of your child. And you have to have documentation at that meeting of a diagnosis. And usually I write letters that provide documentation when I've seen the child, but you can have the documentation from whatever medical professional you've seen who made the diagnosis of ADHD. And then at that meeting, everyone talks about how can we help your child in the classroom. And just some of the common accommodations that I mentioned earlier would be sitting in a place where the child is least distracted and where the teacher can keep eye contact with the child more often, having a extended time if needed for assignments or tests, being able to have a peer in their classroom who helps that child if they're at the age where they're supposed to be taking notes. A peer helper can help the child with notes, but also with organizational skills, making sure they bring home what they need to do homework, making sure they turn in homework when they've actually, when they've completed the homework. So those are all things included in an IEP or a 504 plan with accommodations. that once that document is written, it is a legal document, and the school is obligated to follow all the accommodations in the document. And for the most part, parents, schools, and teachers really try their best to follow whatever was decided might be the most helpful for their child. But on occasion, teachers may not follow the document, and that's when the parent needs to keep constant contact or frequent contact with the school and the teacher to just be sure that everything is working the way it should be working. And then the school has a review of the 504 plan, usually yearly, and the IEP plan is reviewed with the parents usually twice a year, sometimes just yearly. And in those review meetings, if there need to be changes, then, changes can be made to either document.
Right.
Yeah. So I know that with one of my boys' IEP plan, we haven't had a review since he was put on medication for ADHD. But they've made comments like, oh, he's doing so much better because once he gets his medication in him and he gets to school, he's like a different kid, And so I have a feeling that they're going to want to take him off of the behavior part of the IEP plan. But I'm really hesitant to allow them to do that because at any time, that medication could start slowing, like having slower effects. So we may need to change it. And I never want for him to not have the IEP plan and then get in trouble for behavior and us not be able to rely on that IEP plan. Does that make sense?
Yes. So when that happens, the IEP plan, they may want to discontinue that because of improvements. And that's fine to transfer the IEP plan to a 504 plan, which really is just for accommodations for behavior and for the ADHD. But I would not be in favor of discontinuing altogether because you really do want the ability to meet frequently and discuss, because things as you progress through school, as your child progresses into fourth grade and fifth grade and sixth grade, things get much harder and kids get more responsible for turning in their work and all of those things. And so you want the ability for the school to continue to help and provide accommodations when they're needed. So I'm not in favor of discontinuing altogether, but transferring an IEP to a 504 plan is reasonable.
Right.
That makes sense.
I know you spoke earlier about some of the effective treatments of ADHD, and you mentioned behavior modifications in the home through positive parenting. Can you give us just some examples of what positive parenting can look like in the home?
Yes. So the first rule in my mind of positive parenting is catch them being good.
Mm-hmm.
So often that kids with ADHD hear so many critical and messages that are no, don't do that, or stop that, or corrective messages, which you have to do as a parent.
Mm-hmm.
Want to do is balance that with significant positive messages. So if you can notice when your child is playing quietly or when your child does what you ask them to do and give a compliment for that. And the goal would be that you give 5 times as many compliments as you do negative messages. And so the other way positive parenting can play into households is instead of being negative and always having consequences, you do have to have that. You have to have consequences, but you can set up systems with rewards. So if you want your child, for example, to brush their teeth every morning before school without a reminder, you can set up a system where if they brush their teeth in the beginning 3 mornings out of 5 without a reminder, then that gives that child a star. And if the child gets 4 stars in a month, then the child gets an extra 15 minutes of reading with you, or gets trip to the library, or it doesn't have to be food. In fact, I discourage food as rewards, and it doesn't have to be monetary either. It can be anything that your child likes. And sometimes in this day and age, parents use tablet time or tech time as a reward. So that child would get an extra 10 minutes of tablet time or tech time. That's they might earn some technology time. And
sorry, go ahead.
I was just going to say, the one thing parents do often is they'll make a whole list of everything they want their child to be doing. But that really is overwhelming. And so if you just start with one behavior at a time, or one habit that you want the child to develop at a time, and work on that, then you can add other things as they understand that they really are going to get rewarded for doing what you're asking.
So one of the I forgot what I was going to say.
So I have a question that is, I know we talked a lot about the IEP plans, and that's for children who are in public schools. What advice, because that's one of the things that we're walking through right now. Obviously, my son is only 4 and he was diagnosed early. And so he is in preschool where they don't have things like IEPs and 504s. So what kind of suggestions would you give a teacher or someone who is volunteering their time in a church setting, or a teacher in a preschool that does not have access to those tools and may not be as educated about what it works for ADHD children in their classroom, in school or in a church setting? What kind of tangible things could you give them, and advice could you give them on how to accommodate the students?
Well, I think first of all, it's important for the people who are taking care of that child to understand that it will require much more patience. That's a key. And if that person doesn't feel like they can be patient with a child, then maybe someone else needs to take their place. When I say patience, you may have to say to an ADHD child, multiple times, please sit down, or please don't touch your neighbor, or please don't run. You may have to say those things multiple times. It's okay to take the ADHD child and get down on their level, eye to eye, to make sure they hear you. Because frequently in a setting of multiple kids, an ADHD child really doesn't hear the teacher saying, stop it, or the Sunday school teacher saying, sit down, or whoever. They don't hear it. So you have to make sure you have eye contact and that they really hear what it is you're asking them to do. And that takes patience. The other thing I think that teachers need to understand is that the child wants to be good. There's no child that I've ever seen in 36 years that wanted to be bad. They want to be good. They just don't have the brain chemistry or the skills to do it yet. And so it's up to us to be patient, to help them learn how to be good. They don't want to be the kid who's always seen as causing trouble or disrupting the classroom. And so teachers can be really important in the kids' lives, whether they're Sunday school teachers or preschool teachers, if they demonstrate patience and love and forgiveness for those kids who don't quite act the same as kids who don't have ADHD.
So one of the things that you and I talked about the last time I was in the office was the fact that I have twins, and one twin's ADHD is pretty severe. And so I'm the worst comparer of the two. And so I've always said, well, the other one doesn't have it because he doesn't exhibit these symptoms. And at the time, I didn't realize that ADHD is a spectrum. One of the questions that I had for you was, how come they can be twins and one can have it and one can't when they were exposed to the same things prenatally?
Right.
Can you talk about that?
Well, and my suspicion is that they are fraternal twins, not
Yeah.
identical. So basically they have similar genes, but not exactly the same genes. And yes, even though they were exposed to the same substances at the same time while they were in the womb, the difference in the genetic predisposition is what makes the presentation then of the ADHD different. I would suspect that the other twin probably has some ADHD, it's just not the same presentation. And there really is such a huge spectrum. I have every brain with ADHD is just different. I've just seen so many different presentations, and that's what makes it a spectrum.
Can you go into a little bit? I know we talked a little bit about sleep disorders, but can you discuss some of the other common comorbid diagnoses with ADHD?
Yes. So one out of every two kids with ADHD also has a learning disorder of some type. So, for example, slow processing speed, reading difficulty, handwriting difficulty, math calculation difficulty. Also, one out of two kids has oppositional defiant disorder. And that means those are kids who argue with everything that's said. They are very quick to have meltdowns. They refuse to follow rules. They deliberately annoy people. They blame others for their mistakes. But those ODD kids, they also want to be good. They happen to have the ADHD and the ODD together, and often just treating the ADHD helps the ODD get better. And then the other things that are pretty common include anxiety. So 1 out of 5 kids with ADHD has anxiety, and 1 out of 10 will have some depressive symptoms. The anxiety symptoms can be many different symptoms. One is separation anxiety, so being very fearful if a parent leaves them. Another type of anxiety is generalized, just worrying about things that kids wouldn't typically worry about. I had one patient say to me, there is a hurricane that's predicted next November. Now, we're in the month of January, but this hurricane is predicted next November. This is a 10-year-old, and he's already extremely worried about that hurricane. That's not normal. That's anxiety. And the kids with anxiety feel stressed out, very tired, usually edgy almost. So anxiety will improve if you treat the ADHD as well. The other thing to mention is tics, or facial tics, where kids have involuntary movements of their neck or eyes, or sometimes tics can be vocal tics. They can say things and it's involuntary. They can't control that. And that happens in about 1 in 10 people who have ADHD, 1 in 10 kids who have ADHD, they'll have some type of tics. And often if you treat the ADHD, the tics get better.
How is the diagnosis of ADHD made?
So we ask questions about attention, about movement, how hyper students are, and about impulsivity. We ask questions about that to parents and to teachers or people who are around the children every day, basically. So, like preschool teachers or Sunday school teachers, coaches, we ask questions of those people with standardized rating scales. Usually, they're called Vanderbilt scales or Swan scales. And then the other thing is computerized continuous performance testing. So the child is asked to do the same task for 15 minutes if they're under 12, and if they're over 12 for 20 minutes. And we measure every millimeter that they move during that time period, and then we measure how many times they correctly answer or incorrectly answer, and it helps us determine how much inattention and impulsivity is present. And I use a test called a QB test because I feel like it's very accurate, and the retest validity is really very good. So that's the objective piece. The subjective piece is all of the rating scales that we obtain from the people who are around the child.
Dr. Woods, what would you say to the parent who thinks that their child may have ADHD and it's just hit their consideration set even as they're listening to this podcast?
Well, I would say speak with people who also are around your child frequently, like teachers or coaches, and ask, do you think my child listens to you? Do you think my child is able to complete tasks when they're asked to do them? Does my child follow through with whatever the task is? Does my child have problems with staying in their seat or fidgeting? Does my child have trouble interrupting conversations or interrupting the classroom? Are they blurting out answers? Are they able to wait their turn? And so most of the time, if you ask questions about those things, if the child is easily distracted, for example, then you will figure out that other people might be noticing the same thing that you're noticing. And then that's when you would want to talk to your medical professional about the possibility of ADHD.
I know that whenever ADHD first came on the, I guess, thought for me and Josh, whenever it came to our boys, we felt a lot of guilt. And I'm sure Elizabeth can relate to that too. There was just a lot of guilt about putting my child on medication and having a diagnosis and, I guess, putting the scarlet letter on him. What would you have to say to parents who have this overwhelming guilt? Now I don't have any guilt. Now I'm so thankful for the medication. But in the beginning, before we came to you, there was so much guilt behind that decision.
And it's really common. It's very common for parents to feel very guilty. But first of all, this is a medical illness, just like asthma or diabetes. And so you wouldn't deny your child insulin if he or she had diabetes, and you wouldn't deny them medication for their asthma. So parents shouldn't feel guilty when they seek treatment for the ADHD symptoms. It is a biological event in the brain where chemistry needs to be better balanced, just like diabetes is a biological chemical event from the pancreas where insulin needs to be better balanced. So I understand that there's been terrible stigma about ADHD and about ADHD medications. But what I would say is, please don't let other people judge you, because you will be judged. You will get looks from parents in grocery stores. You will get looks from the pharmacist when you go to pick up your medication. You will get comments, oh, if they would just spank him more, he would be better. Those are full, and you just have to let them roll off. You cannot spank ADHD out of children, but you can really improve their success in school and in life by getting it evaluated and treated.
Thank you so much for that. That's so funny. I've literally heard that exact same statement. If you just spank him more, or if you just punish him more, and I'm like, holy crap, I punished the kid enough. I feel I can't do anything.
Right.
Well, and also, like, I feel that, you know, as adoptive parents, we're already, you know, trying to be ethical in our mindset about adoption and how we're communicating adoption with our children. And so this just adds one more, you know, thing that we need to keep aware of. And so I love the way that you put that kind of, you know, let those things roll off of you and don't absorb that criticism from whether it just be visual criticism or actually someone actually commenting on your parenting skills, just to let that roll off and not absorb that. So that's super helpful. This podcast, I think, is going to be so eye-opening for so many people, and I think it's going to be very, very helpful. So we just want to say thank you, Dr. Woods, for your time. We really appreciate you being on the podcast for us.
Yeah.
Oh, well, thank you so much, because it is really important to help. I think the more understanding we can spread around, the better our kids will be.
Have you heard about the Promise Summit? If you are out there and you're listening right now and you are hoping to adopt, or you're an adoptive parent, or you're struggling with infertility, or maybe you feel called to adoption and you just have no clue where to start, then you need to be at the Promise Summit. Casey, tell us a little bit about what the Promise Summit is.
The Promise Summit is a Christian conference for couples considering adoption, in the wait of adoption, and or families who have adopted. This event is packed with powerful speakers, incredible worship, and a panel that represents all members of the adoption triad, and is sure to be a weekend that you will never forget. Our hope is that you leave the Promise Summit forever changed and armed with the promises from God that will encourage you throughout your entire adoption journey.
The Promise Summit will be held May 3rd and 4th in Greenville, South Carolina, and we would love to meet you there. You can find out more information at thepromisesummit.com or on Instagram at thepromisesummit.